Welcome to SATU Career 2.0 online nursing channel. In today's video, we are going to discuss 50 questions for Railway Recruitment Board Nursing Officer exam. This video will have 50 questions. In our next video, we will have another 50 questions. Totally, we are going to discuss 100 questions. Before going to today's video, please subscribe to SATU Career 2.0 online nursing channel. If you have not yet subscribed, please click the bell icon to get the latest notification about our new videos. Let's see the first question of the day. WHO headquarters of Southeast Asia region is in A. Bombay, B. Lahore, C. Manila, D. New Delhi. The right answer is option D. New Delhi. Question number 2. Following are high risk antenatal cases except option A. Elderly prime, B. Pre-eclampsia, C. Twin pregnancy, D. None of the above. The right answer, option D. None of the above. Question number 3. All are true about barrier methods except A. Absence of side effects as compared to IUD. B. Protects from sexually transmitted diseases. Option C. Increased risk of pelvic inflammatory disease. Option D. Some protection of risk of cervical cancer. The right answer, option C. Increased risk of pelvic inflammatory disease. Question number 4. Which is true about community health center? A. It covers a population of 1 lakh. B. It has 60 beds with specialties in surgery, medicine and gynecology. Option C. Community health office is selected with a minimum of 5-year exposure. Option D. New medical post of community health officer is created. The right answer is option A. It covers a population of 1 lakh. Question number 5. Mutism, negativism, ambitendency, echolalia are the symptoms among A. Hysteria, B. Catatonia, C. Suicide, D. Panic attack. The right answer, these are the symptoms of catatonia. Question number 6. Short stature and undeveloped ovaries suggest which of the following disorders? Option A. Polycystic ovarian syndrome, B. Prolactinoma, C. Graves' disease, D. Turner syndrome. The right answer is option A. Polycystic ovarian syndrome. Question number 7. The following bronchodialator is most commonly used when doing a reversibility test. Option A. Adrenaline, B. Salbutamol, C. Theophylline anhydrous, D. Atropine. The right answer is option C. Theophylline anhydrous. Question number 8. Clusters respiration is otherwise known as A. Bitort's respiration, B. Tachypnea, C. Kussmaul's respiration, and D. Hyperventilation. The right answer is hyperventilation. Question number 9. Blood flow through the coronary arteries primarily occurs during A. Expiration, B. Inspiration, C. Systole, D. Diastole. The right answer, option D. Diastole. Question number 10. When a client has peptic ulcer disease, the nurse would expect a priority intervention to be option A. Assisting in inserting Miller-Abbott tube, B. Assisting in inserting a arterial pressure line, option C. Inserting a NG tube, option D. Inserting an IV. The correct answer is option C. Inserting a NG tube. Question number 11. By which route measles vaccine is given? A. Intramuscular, B. Intradermal, C. Subcutaneous, D. Intrathecal. The right answer is subcutaneous. Question number 12. Billiverdin is the breakdown product of A. RBCs, B. WBCs, C. platelet, D. plasma. Right answer is RBCs. Question number 13. When infant's head is turned to one side, arm and leg extend on the side and opposite arm and leg reflexes termed as option A. Moro's reflex, B. Purse reflex, C. Tonic neck reflex, D. Gallant reflex. The right answer option C. Tonic reflex. Tonic neck reflex. Question number 14. The sequence of steps of neonatal resuscitation. Option A. TABC. Temperature, airway, breathing, circulation. Option B. ABCT. Option C. TCBA and D. ABCT. The right answer option A. Temperature, airway, breathing, circulation is the sequence of steps of neonatal resuscitation. Question number 15. Pattern of development over the body from head to foot is called as option A. Cephalocaudal pattern, B. Paroxymodal pattern, option C. Neuromuscular pattern, option D. Sensory growth pattern. The right answer option A. Cephalocaudal pattern. Question number 16. The following are WHO recommendation for recording blood pressure except option A. Record blood pressure in supine position, B. Use one arm consistently, C. Measure thrice at 3 minutes interval, option D. Record the lowest of 3 readings. The WHO recommendation for recording blood pressure is all except record BP in supine position. Question number 17. In India, main cause of death due to hypertension is A. Coronary heart disease, B. Congestive heart failure, C. Stroke, D. Renal failure. The right answer option C. Stroke. Question number 18. Mechanism of action of progesterone only pill is A. Anti-spermatozoic, B. It prevents ovulation, C. Makes the cervical mucus viscid, option D. Alters tubal mobility. The right answer is it makes the cervical mucus viscid. Question number 19. Father of public health nurse refers to option A. John Snow, B. John Williams, C. William Budd, D. Jose Wood. Father of public health nurse refers to option A. John Snow. Question number 20. Rubella infection in the second trimester leads to A. Deafness, B. Spontaneous abortion, C. Stillbirth, D. Patent ductus arteriosus. The right answer is option A. Deafness. Question number 21. Nissen's fundoplication procedure is done to treat A. Intestinal obstruction, B. Hirschsprung disease, C. Gastroesophageal reflux disorder, option D. Pyloric stenosis. The correct answer is GERD. Question number 22. Dietary intake of calcium should be reduced in clinical condition. Which clinical condition? Dietary intake of calcium should be reduced. Option A. Hypoparathyroidism, B. Hyperparathyroidism, option C. Hypothyroidism, D. Hyperthyroidism. The right answer is hyperparathyroidism. In this condition, dietary intake of calcium should be reduced. Question number 23. What will happen to the sugar content of CSF during bacterial infection? A. Normal. B. Decrease. C. Increase. D. No sugar. The right answer is it will decrease during the time of bacterial infection. Question number 24. Presence of Bence-Jones protein in urine analysis is a characteristic feature of A. Nephrotic syndrome, B. Glomerulonephritis, C. Multiple sclerosis, D. Multiple myeloma. The right answer is option D. Multiple myeloma. Question number 25. Menstruation at regular intervals but with excessive flow and duration. Option A. Menorrhagia, B. Metrorrhagia, C. Polymenorrhea, D. Oligomenorrhea. The right answer is option A. Menorrhagia. Question number 26. The process by which a liquid medication is introduced into a cavity drop by drop is known as A. Instillation, B. Irrigation, C. Insertion, D. Inhalation. The right answer is option A. Instillation. Question number 27. Which clinical condition is identified by triple test in pregnancy? Option A. West syndrome, B. Down syndrome, C. Pyrie-Robinson syndrome, D. Klinefelter syndrome. The right answer is option B. Down syndrome. Question number 28. Management of dumping syndrome is best accomplished by planning to maintain the client. Option A on high fiber diet, B on low fat diet, C on low protein diet, D fluid only diet. The right answer is on high fiber diet. Question number 29. Complete absence of spontaneous movements with mutism, negativism and rigid posturing is A. Delusion, B. Stupor, C. Dementia, D. Delirium. The right answer is called stupor. Question number 30. Who differentiated psychiatric illnesses to dementia precox and manic depressive illness? Option A. Sigmund Freud, B. Eugen Bleuler, C. Kurt Schneider, D. Emil Kraepelin. The right answer is Emil Kraepelin differentiated dementia precox and manic depressive illness. Now we see some of the complicated questions. Question number 31. Which complication of cardiac catheterization should the nurse monitor for in the initial 24 hours after the procedure? Option A. Angina at rest, B. Thrombus formation, C. Dizziness, D. Falling blood pressure. The right answer is option B. Thrombus formation. Question number 32. A client is admitted to the emergency room with renal calculi and is complaining of moderate to severe flank pain and nausea. The client's temperature is 100.8 degrees Fahrenheit. The priority nursing goal for this client is A. Maintain fluid and electrolyte balance, B. Control nausea, C. Manage pain, D. Prevent urinary tract infection. The right answer is to manage pain. Question number 33. A client has been newly diagnosed with hypothyroidism and will take levothyroxine synthroid 50 microgram per day by mouth. As part of the teaching plan, the nurse emphasizes that this medication, option A, should be taken in the morning, B, may decrease the client's energy level, C, must be stored in a dark container. D will decrease the client's heart rate. So in the teaching plan, the nurse emphasized about this medication on taking this drug at morning time. 34. In children suspected to have a diagnosis of diabetes, which one of the following complaints would be most likely to prompt parents to take their school age child for evaluation? A. Polyphagia. B. Dehydration. C. Bedwetting. D. Weight loss. In school age children, the symptom which worries the parent and make them to take the child for evaluation is bedwetting. Question number 35. A client comes to the clinic for treatment of recurrent pelvic inflammatory disease. The nurse recognizes that this condition most frequently follows which type of infection? Option A, trichomoniasis. B, chlamydia. C, staphylococcus. D, streptococcus. The right answer is chlamydia. Question number 36. When teaching a client with coronary artery disease about nutrition, the nurse should emphasize option A, eating 3 balanced meals a day. B, adding complex carbohydrates. C, avoiding heavy meals. Option D, limiting sodium to 7 grams per day. The right answer is avoiding heavy meals is advised when we give nutrition advice to patient with coronary artery disease. Question number 37. The nurse is speaking at a community meeting about personal responsibility for health promotion. A participant asks about chiropractic treatment for illness. The what should be the focus of the nurse's response? Chiropractic. So here the option A, electrical energy fields. B, spinal column manipulation. C, mind body balance. And D is exercise of joints. So in chiropractic, the main feature is spinal column manipulation. It is one of the alternative and complementary therapies. Question number 38. The nurse is performing a neurological assessment on a client post-right CVA. Which finding is observed by the nurse would warrant immediate attention? Option A, decrease in level of consciousness. B, loss of bladder control. C, altered sensation stimuli. D, emotional lability. The finding which warrant immediate attention will be option A, decrease in level of consciousness. Question number 39. A child who has recently been diagnosed with cystic fibrosis is in a pediatric clinic where a nurse is performing an assessment. Which later finding of the disease would the nurse not expect to see at this time? Option A, positive sweat test. B, bulky greasy stool. C, moist productive cough. D, meconium ileus. The right answer is moisty productive cough, which is a later stage of signs and symptoms in cystic fibrosis, should not be present in the child at this time. Question number 40. A nurse prepares to care for a 4-year-old newly admitted for rhabdomyosarcoma. The nurse should alert the staff to pay more attention to the function of which area of the body? Option A, all striated muscles. B, the cerebellum. C, the kidneys. D, the leg bones. So in rhabdomyosarcoma, the attention of the nurse should be on all striated muscles. Now let's see some of the general knowledge questions. Question number 41. Pradhan Mantri Kisan Samman Nidhi Yojana PM Kisan was launched at A. Ahmedabad, B. Varanasi, C. Vastral, D. Amritsar. The right answer, Pradhan Mantri Kisan Samman Nidhi Yojana launched at Vastral in Gujarat. Question number 42. The place in Uttar Pradesh at which the foundation stone of National Institute of Unani Medicine was laid by Union Minister of State for Ayush Shripad Yesso Nayak is option A. Ghaziabad, B. Varanasi, C. Mathura, D. Lucknow. The right answer is option A. Ghaziabad. Question number 23. One who studies election trends by means of opinion polls is called as A. Entomologist, B. Psephologist, C. Demagogue, D. Eugenist. The right answer is Psephologist. Question number 44. The Art of Living, a Guide to Contentment, Joy and Fulfillment. This book was written by option A. Sri Ravi Shankar, B. Dalai Lama, C. Osho, D. Chetan Bhagat. This book was written by option B. Dalai Lama. Question number 45. The West Indian cricketer who has become the first in the world to hit more than 506 sixes in international cricket. Option A. Chris Gayle, B. Brian Lara, C. Roger Holder, and D. Stuart Williams. The right answer is option A. Chris Gayle. Question number 46. The Gatimaan Express is currently regarded as India's fastest train and takes just 265 minutes to cover 402 kilometers. Which Indian city does it connect to New Delhi Hazrat Nizamuddin Station? Option A. Agra, B. Jalandhar, C. Jhansi, and D. Lucknow. The right answer, option C. Jhansi. Recently, this train was extended from Agra to Jhansi. Question number 47. Who is the only Indian to present six consecutive railway budgets? Option A. P. Chidambaram, option B. Lalu Prasad Yadav, option C. M.S. Gill, option D. Rahul Gandhi. The right answer, the railway minister who presented six consecutive railway budget is Lalu Prasad Yadav. Question number 48. The longest Rajdhani route in the country also features the longest non-stop run of 528 kilometers. Which city does the Rajdhani connect to Delhi? Option A. Kanyakumari, B. Mangaluru, C. Chennai, and D. Trivandrum. The right answer is option D. Trivandrum. So non-stop for 528 kilometers. And question number 49. What was the theme of 2019 International Women's Day? Option A. Women in the Changing World of Work. Planet 50-50 by 2030. Option B. Time is now. Rural and urban activists transforming women's lives. Option C. Think equal, build smart, innovate for change. Option D. Empowering women, empowering humanity. Picture it, which is the 2019 International Women's Day theme. The right answer is option C. Think equal, build smart, innovate for change. Question number 50. It is a subscribers question. No answer will be told. You have to find the answer and comment the answer in the comment box below. Who launched a new app, Bolo, in India to help children in primary school learn to read in Hindi and English? Option A, Facebook. B, Twitter. C, Google. D, Apple. So which company launched this app called Bolo in India, which help the children in primary school to learn to read in Hindi and English? So find the answer and write the answer in the comment box below. Now, thank you for watching this video. Subscribe to our channel if you have not yet subscribed, and please like and comment about this video. Thank you.